Hi, hey you guys, I'm Chrissy Pooh back with another video. So today I wanted to talk to you guys about something a little different on my channel. I guess a lot of people don't know a lot of my background as far as the issues that I've been dealing with as far as trying to conceive, trying to have kids, trying to hold kids, whatever the case may be, but trying to have babies. So I wanted to talk to you guys about this. This has been long awaited ever since I started even recording a YouTube video because it's so near dear to my heart and I wanted to give you guys facts. I wanted to tell y'all everything that's going on. Maybe it can help someone. Maybe you can give this information to somebody who might need it, but it's definitely something that needs to be talked about on my end and just to help other women deal with this issue. Maybe something I say might help or whatever the case may be. So as you could tell by the title, I wanted to talk to you guys as far as pregnancy losses, miscarriages, and that's, pregnancy losses from, up until further on within the pregnancy and in the beginning stages of a pregnancy. I've had issues with both. So even somewhat of a fertility issue. So I could talk to you guys about some of my experiences. These are my experiences. I'm not trying to diagnose anybody. I'm no medical professional whatsoever. So this is just me telling you what I've been through. It took me a while to record this video just because I'm not really sure. Like, I wanted to talk to you guys so long about this, and I'm not really sure as to why I contemplated so long for making this video, but today I'm making a video. I've been missing for a second, and it's not related to this issue, but I've just been missing for a second, and it's been weighing heavy on me, and I just wanted to make the video. So, by the way, if you like my hair, I did do a hair review on it. Just another side note, but yeah, let's get back to this video. I did do a hair review on this hair. You guys could go check it out. But yeah, let's jump right into this video and everything that I want to say. I'm not gonna lie to y'all, I'm gonna be all over the place just because it's so much that I want to say. It's so much to talk about within this topic that I really don't know where to begin, but I'm going to begin with, I guess, what an incompetent cervix is. So I do have the actual definition pulled up just because I wanted to read to y'all like exactly what it means. I could just, give you my definition of it, but I'm gonna tell you exactly what it means. So incompetent cervix is also deficiency occurs when weak cervical tissue causes and contributes to the premature birth or the loss of an otherwise healthy pregnancy. So, my definition of that is simply when you start to dilate or your cervix start to open before you're due full term or whatever. So that's what I have been experiencing ever since I first gotten pregnant back in 2012. I wrote down notes as to my timeline and my time frame within my pregnancies and my losses because I wanted to give you guys facts, and I wanted to get it straight with you guys. So I've been through so much that it's kind of hard to pinpoint which pregnancy happened the way that it did, if that makes sense. I've had, throughout the time of me trying to get pregnant and to have a successful pregnancy, I've had 4 losses. So 3 of them was due to an incompetent cervix, and the one was just an early miscarriage. So that's what I meant when I said that I wanted to talk to you about different kind of pregnancy losses. So I have in my notes, if you wonder what I'm looking at my iPad. I have in my notes exactly when all my losses occurred. I can't give you exact months or whatever, but I can at least tell you the year. So my losses incurred between 2012 and then 2016. Yeah, 2012. No, I'm sorry. 2012 and 2015. So they were kind of like back to back because I was actively trying to get pregnant and I was trying to have a successful pregnancy. And in the beginning of the losses, it's hard to pinpoint what's going on. So my doctor did not diagnose me with having an incompetent cervix until my third lost pregnancy, and I will explain how that was a loss. So, well, you know what an incompetent cervix, I explained that and everything. So in 2012, let's start with my first pregnancy. 2012, everything was going fine. I'm sorry if I don't give you the exact weeks that I was and everything, but I'll tell you around about where I was. 2012 was my first pregnancy. I named her and everything. Every pregnancy, I was past the mark of finding out what I was having. Either I went to an early sonogram place or I found out through my doctor. Also, so all three of my losses, not the early miscarriage, but all three of my losses, they were all baby girls. 2012, Jaden. That was my baby girl name. 2012, Jaden. I was pregnant with her. I don't know. I had this pain. So I'm gonna just tell y'all the days that I lost them, pretty much. I kept having this pain. I probably was around, I want to say 16 weeks. I kept having this pain. It was like all day. It was a dull pain. It wasn't like something like really painful, but I did contact my doctor. I went to the doctor's office. They said everything was fine. But I just kept having the pain. So later on at night, I'm not really sure, but I ended up going to the ER. I don't know. I guess it was because of the pain or something. Like, I can't really remember. But I ended up going to the ER. They ended up actually admitting me. I'm sorry, you guys. Like, the details of this is like... It's like I'm trying to figure out, like, what exactly was going on. But I kept having this pain anyway. So I do remember the day that I ended up losing her or whatever. I was sitting in a hospital bed. I was actually talking to Cam on the phone. And so I kept having like these pains, intermittent pains. And it was like back to back. And it started like coming faster and faster. And I'm guessing now, obviously, it was probably contractions. But anyway, so my water ended up breaking. And so I called the nurse and Cam was on his way because we were already on the phone. He heard what was going on. My water ended up breaking. The nurse checked me. She like, are you sure you didn't pee on yourself? I'm like, I'm pretty sure I would know the difference. But anyway, so she found out that my water broke. They took me down. They did an ultrasound on me. And I could see on the screen that the baby was pretty much coming down my cervix. Like, I could literally see that, like, she was on her way out. And so the nurse, obviously, they didn't want to tell me. So I had to wait for the doctor to pretty much tell me that the baby was, you know, coming down or whatever. So I ended up having to deliver her, which all three of the ones where I said that I had went into preterm labor, they can call them miscarriages all they want to, but I say preterm labor. All three of them, like I said, was girls, and all three of them I had to freaking deliver. So I ended up delivering her, I believe... I don't think that was that time. But anyway, I ended up delivering her. Each one of my baby girls I held. They were not breathing by the time that they came out. She was not breathing. I held her. I just sat there. I stared at her. I had my moment. So in the hospital, when you have a loss, they give you this box, they give you the footprint of the baby, they give you like, little handprints, little mitts, or like the little hats that they put on them, like the crochet hats and that type of stuff. They give you the details when you had or all that stuff that they would normally give you if you had a successful pregnancy or whatever. So, okay, let's fast forward to 2013. Like I said, these pregnancies was pretty much back to back, and that could have been what led to what I'm about to tell you, which was an early miscarriage. So sometimes when you don't let your body rest, that could also contribute to you having an early miscarriage. To tell you the truth, guys, I'm not sure whether the early miscarriage happened after this first pregnancy that I told you about or the second one, but I just pinpointed it to 2013. It might have been 2014, and I'm not sure, but like I said, I've been through a lot. I didn't necessarily, I'm horrible with time frames and everything, so I didn't necessarily have a pinpoint for everything. So 2013, I will say, was the early miscarriage. What happened then, so I found out I was pregnant. I went to the doctors. They, confirmed it or whatever. So one day I kept cramping. Like during your pregnancy in the beginning, you do cramp. But I started feeling something down there. So I ended up realizing that I was bleeding. Made a doctor's appointment. She pretty much told me by the time that I got there, everything was pretty much, out as far as the baby tissue and everything. So yeah, that was that. That was hard for me, but it wasn't as hard for me as these other situations. That definitely had nothing on my next pregnancies. And obviously my first one. So fast forward to 2014. So 2014, and you guys, this pregnancy was the furthest I went in a pregnancy. Everything was fine leading up to this point. Nothing was wrong. Ultrasounds was perfect. Baby was growing. Everything was fine. So I was 22 and a half weeks. I remember this because this pregnancy was so detrimental to me, because when you think 22 and a half weeks, that's 5.5 months pregnant. You thinking you about to have your baby. You thinking about a baby shower. You thinking about all these kind of things. So that pregnancy for me was just, that was hard to lose. That was really hard to lose. Yeah. Anyway, so what happened during that pregnancy was, so one night I kept having these pains. For some reason, like the pains, they hurt, but for some reason I was like in and out of sleep. I don't know whether I was just that tired or what, or I don't know, but I was in and out of sleep. So at some point I decided to get up and go to the bathroom. At this point I realized that I was bleeding. Bleeding. So, I called a cab. We went to the hospital. I'm sorry, you guys. I'm so sorry. So the first pregnancy in 2012, that was due to, what they came up with for the explanation for that was that it was due to me having an infection. So that's why I lost that pregnancy. With the one that I'm saying now, in which I was bleeding, it was I guess it was some type of rupture of something. I'm not really sure But it was some type of rupture or something, and I ended up losing that pregnancy as well, obviously. So I believe, so like I said, I was 22 and a half weeks pregnant. Now, when I went in to get checked, I can't really remember what they said in regards to my bleeding, but I do know that the baby still had a heartbeat. So baby girl still had a heartbeat. So I was 22 weeks pregnant. Viability for a baby in most states is 24 weeks. Viability means when they're at the point to where as though they can be pretty much saved, or they, have developed to a certain point to where as though it would actually make it possible for them to be saved. So I was 22 and a half weeks, like I said. The hospital I was at said that if I was at least 23 weeks, that they would take the baby into the NICU. I mean, try to save the baby, in other words. So her heart was still beating, so I was holding on. Mind you, they was giving me medication, but it was only with so much they could give me with, me still being pregnant. And I didn't really want to do too much in that regard. So I still was in pain. And I was going to live through that pain for as long as her heart was beating. I was going to live through that goddamn pain. But it didn't even, she I guess held on for as long as she could. At some point they checked me again, and her heart wasn't beating. So I had to end up delivering that baby as well. Yeah. But like I said, it just was, as far as I know, my placenta, all that it was fine. Like I don't remember them saying anything to me in that regard. Like I'm not really even sure whether they knew where the bleeding was, because I think that they told me it just was like another infection. So in my mind, I'm gonna just give y'all like what I'm thinking in my mind. In my mind, I'm not thinking that I can't never have a successful pregnancy. That is why I got pregnant back to back, because they never told me, or was no inclination that I could not hold a pregnancy at that point. At that point, I'm thinking, God just don't freaking like me right now. Like that's what I'm thinking. I'm in my mind. I'm like, why is all these people, you hear these horror stories of people killing their kids, leaving their kids in the car, just doing crazy stuff to their kids. And I'm like, how the heck do they get kids, but I cannot? So that's what I'm thinking in my mind, you guys. I'm not thinking that I can't hold a pregnancy. I'm just thinking that I'm having a crappy time with my pregnancies right now. So fast forward again, 2015, I get pregnant again. Now in 2015, I went to a different doctor. She said to me, based off of my pregnancy history, this is when I first heard about having incompetent cervix. So she said to me, you have an incompetent cervix. We went through all of that. And she said to me that you could possibly have a vaginal cerclage. Now, I'm going to show y'all on the screen what a vaginal cerclage is. But it's pretty much a stitch that they put at the, top of your cervix, or the top of your vagina at this point. But you can see it by the picture, that they kind of close your vagina. Or they close your cervix, not your vagina. They close your cervix so that you will not dilate and end up having a baby early. So I believe I was already pregnant at this point. Usually the vaginal cerclage, it's called a transvaginal cerclage. At this point, they usually do it around 13 to 15 weeks, I want to say. So yeah, they place the transvaginal cerclage, around that time. I want to say I got to 19 weeks. Okay. And one day I just realized I was leaking. I was leaking fluid. So I go to the hospital, yada yada. At this point, every time I go to the hospital has been an absolute disaster for me, so I don't expect any positivity from this visit. In my mind, I'm like, I'm about to lose my baby. So they told me that I was leaking abdominal fluid, obviously. It wasn't enough around the baby. My bag was actually bulging. So the cerclage was kind of, I guess, like popped or whatever. And the cerclage, not the cerclage, my bag, the amniotic sac was bulging at this point, like through the stitches of the cerclage. So I ended up having the baby. At this pregnancy, I believe, was the one where they gave me Pitocin, oxytocin, to dilate you or whatever. Because the baby heartbeat wasn't, the baby didn't have a heartbeat. So they gave me Pitocin, oxytocin to, sorry, you guys, I'm cutting the TV off. But they gave me Pitocin, oxytocin to end up having the baby or whatever. Like I said, everything was like normal label, you might as well say, just with a smaller baby. So I had to use the bathroom. So I realized when I used the bathroom, I felt the baby come down. And you guys, I don't know why I was so terrified, but I was so terrified to look in the toilet. Like, it was just like, it was, to me, it's like a horror story that I'm like reliving. You know what I'm saying? Like, I was so scared to look down in the toilet. I didn't open my eyes. I let the nurse come. I called for the nurse. I let the nurse come. They did everything that they were supposed to do. And I was so terrified to look down in the toilet. I just did not want to. And like I said, the baby was not breathing at that point. So it was really nothing that they could do. It's nothing they can do at 19 weeks anyway. So that's really extremely too early. But, so I ended up holding that baby too. And once they, did everything that they were supposed to do, they gave me the box. So I got 3 boxes here in my house of me reliving everything that I'd been through. So, after that failed pregnancy, what they call it is when your cerclage fails. So after that, my doctor actually told me to go and, talk more with my insurance, and they kind of directed me to a doctor in Chicago who actually deals specifically with incompetent women who have incompetent cervix. Now, this Dr. Haney out of Chicago Med, it's just not enough words in the vocabulary for me to explain this man. I just thank God so much that he put that man on this earth, because I really don't know what I'd have did. It was other outlets, obviously, but it's just, like, he's very well known as far as incompetent cervixes go. If you Google incompetent cervix, he would pop up. That's how popular he is. So I did have a phone. Let me put this down. I had a phone consultation with him, because that's what he does in the beginning. He wants to make sure that you're the perfect candidate for getting a. Oh, so that's what my doctor led me to. As far as the next stage of a transvaginal cerclage is a transabdominal cerclage. And once again, I'll have the picture on the screen to show the difference between the two. It's like a couple of transvaginal cerclages. And like I said, I had the picture up. But this one, the transabdominal, is supposed to be more effective. So yeah, that's what I was talking to him about, possibly getting surgery to get that done. Like I said, I had the picture up on the screen, so you could see exactly what I had done to me. So in November 2016. I was not pregnant, you guys, because at this point, I know what's wrong. I'm clearly not going to get pregnant again because from my understanding of the situation, no matter how many times I would have gotten pregnant, I would have lost the pregnancy. So in 2016, excuse me, 2016, I had my phone consultation. I booked my flight. I, did everything I needed to do through insurance. So I was going to Chicago. We and Cam, we both flew to Chicago. At this point, he actually just had knee surgery, you guys. He just had knee surgery, but I did not have anybody else that could go with me at the time. So he actually wanted to go. He was very adamant, obviously, about going. So on the upside of that, we got to get on our flight first by him having crutches and everything. So anyway, we get to Chicago. I believe I arrived a day before, either a day or two before my actual surgery date. Like I said, this was in November. I think this was like election time and everything. So my actual surgery day, I went in. They had me in the PACU. I actually got to meet this man. When I tell you he has such a great heart and a personality, like, it's like he gets dealing with patients. He gets your frustration. Like I say, he specializes in this, so he understands obviously understands to a certain point of what you're going through, and he gets it. He gets it. That's all I can say. Like, I just wish this man, I don't even know what I'm saying right now. Like, I just thank God for him. That's all I can say. I just thank God for him. But anyway, so he was wonderful and everything. So we met, we did my surgery. I came back to the PACU. When I tell y'all, I don't know what they give y'all when they put you to sleep, but I believe it was propofol. I don't know. But if it was propofol, I understand why Michael, kind of overdose on that thing, because that is like the best sleep I ever got in my life. Like, they took me to the PACU and woke me up, and I was mad. Like, I was legit mad that they woke me up. Like, I feel like I was in the best sleep of my life. But anyway, so yeah, so he's like, pretty much, you can get pregnant right away. Like, girl, you can go home as long as you feel up to it. You can get pregnant right away. So I'm like, okay, that's nice to know. Anyway, so me and Cam, we was, I guess you could say, trying after that point. I can't remember exactly when we went home. I know that day after the surgery, obviously we stayed there. I remember being there, and this is when I had my surgery. We stayed at we actually stayed at Red Roof. I wasn't even concerned about it. Like, I just was like, let's go ahead and do this. We stayed at the Red Roof, but I remember going to sleep and waking up, and we had just realized that Donald Trump had won the election. But anyway, that's another story for a different day. But it's over and done with now. So yeah, so that was the time frame for y'all. Like, that was the day for me that I got surgery. We ended up getting a new freaking president. Anyway, so I remember on the, like, going to the airport and the flight back, and once I got home, and those bumps, let me tell you, baby, those bumps hit me. I had one bad day, and I had one bad, like, occurrence, if you will, in Chicago, in which I just was, like, I do very well. I have a high pain tolerance, but that night I just was going through it in Chicago. Like, I don't know whether it was, like I said, because he won the election or what, but I just was going through, I was in so much pain. But anyway, like I said, on the flight back, I believe I was fine. It was the drive. It was actually the driving part that really kind of got me. The bumps was horrible on me. Like, the bumps was horrible. Like I said, I have a huge pain tolerance. So obviously to somebody else, it would have been a little bit more hurtful. But, yeah, the healing process for me really wasn't that bad. I really don't know what else to say. But so fast forward. I believe, so like I said, my surgery was in 2016. I believe I got pregnant in 2017. Well, obviously it had to be in 2017. So I got pregnant in 2017. You guys, like, when I tell you I was worried, like, off my buns, the whole I gotta stop cussing. I was worried my whole pregnancy. Everything was the issue. I went to the doctor for everything, no matter what I felt. You know, I don't even know how to explain it, but anyway, we got to the point to where as though, we were setting up surgery dates for my C-section, and surgery date came. I had my C-section. I had a wonderful, healthy baby boy born 5 pounds, 7 ounces in 2018. And I couldn't be freaking happier. I could not be freaking happier. I will say that with this surgery, you guys, you have to absolutely get a C-section. I think it is possible to get the stitches taken out, but then you would have to have a whole nother surgery to get them taken out and then get the C-section. And if you actually planned on having more kids, that just wouldn't make sense, because then you would have to get the surgery again in order to have another child. So I still have in my cerclage. I still have it and don't plan on taking it out. It's no reason to. So with every pregnancy I have from 2016, the time that I had that cerclage placed, it will be successful. The baby will be coming out full term and everything. I'm like ecstatic. I'm happy. I have no reason to worry anymore. Now, it is possible for a transabdominal cerclage to fail, but the possibility rate for that is extremely low. I've even with the transvaginal one, I've heard women have a successful pregnancy with that. I've heard some that it failed on, obviously me. The transabdominal, I've never heard anyone failing on that cerclage. I have never heard. I've heard stories online, just reading like the possibility rates and everything, but I've never seen a woman say that it failed her. I will say I do have a resource for you guys as far as like dealing with having an incompetent cervix. I've came across this website. It's called Abby Loopers. I'll have that on the screen. I'll also have the link down below. You will have to log into this site or register or create a login. This site, you guys, has helped me so much. It's not even funny. Even if you do not have an incompetent cervix, some women have like hella early miscarriages. Even if that's you, I suggest that you use this site, utilize the site, see what these other women have to say. Some of these women have been through like 12 early miscarriages. Like, I'm not even exaggerating. Like, the stuff that we go through as women is crazy. Like, I can't even believe having that many miscarriages. Like, I can't imagine, you guys. So definitely go check this website out. You have women from overseas. I mean, I've seen women from India on this website trying to find a doctor like Dr. Haney. Excuse me. It's women literally from all over going through the same situation that we are going through. So definitely go check this website. It's a wonderful resource. It's a wonderful tool. I'm telling you, it's really nice having somebody go through something that you are going through, and to have them around, be able to talk to them. It's just not the same as having just somebody who obviously has an experience what you experienced. It's just better having somebody who experienced what you experienced. So I will say, you guys, one thing I did not mention during this time was from the time that I had my cerclage in 2015 to me getting pregnant in 2017, my doctor did have me on progesterone. Not the suppositories, but the shots. Now, I believe it's called, I don't know if it was called this the whole time, but I feel like it was. Yeah. So it's called McKenna. MAKENA. These shots you do, the first time I was pregnant and I was using, I did it in my butt, and I had a nurse actually, which you can see whether you can get approved through your insurance, but I had a nurse inject me every week, come inject me every week for this shot. And then my pregnancy in 2017 with Kai, my baby boy, I actually ended up doing it myself. And at this point, it's like an auto injecting, which you will put in your arm. Now, these progesterone shots is supposed to help you not dilate. It's supposed to help your pregnancy, and it's supposed to help you not dilate and make sure your progesterone levels where they at, and make sure you have a healthy pregnancy. I'm not sure about the suppositories. I think the suppositories are done normally when women have early miscarriages, if I'm not mistaken. Those help very well with that. But for my situation, it was for the ending part of my pregnancy, I guess like the second and third trimester, if you will. I never had really an issue in the first trimester. Like I said, I had that early miscarriage, but that, probably occurred because it was just a lot of stress on my body at that point. Now, like I said, I was getting pregnant back to back. So, like I said, I will have the link for the forum, for Abby Lupus. It's like a chatting forum, like it's actual threads that you can look through to see like what was discussed previous to you actually joining. It's a good resource, you guys, and I really hope you guys use it. I don't know what else I haven't talked about. If it comes to mind, I'll try to just either make a second video if you'd like me to, if you have any questions, or I'll link it down in the description or whatever the case may be. But please, please, please. Oh yeah, and also well, I had my baby girl, so that is proof that the transabdominal cerclage works. I had the baby boy in 2018. I just had my baby girl 2020. She just turned 1 year old, December 10th. Like I said, successful pregnancy. I couldn't even complain at all. But yeah, you guys, please, 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 if you have any questions, whether you feel like it's related to my situation or not, just hit me up. If you need somebody to talk to, hit me up. If you do not want to put it in the comments, I always link my email down below. Talk to me. That's all I can say is talk to me, because at some point there was a time where I needed somebody to talk to. So just talk to me. That's all I can say. Like I said, I'll have the links down below for the website I was talking about and everything. But thank you guys for listening. I hope you stayed the entire time through the video. If you did not and skipped some parts, thank you as well, as long as you know that this is even possible. Because like I said, before I was diagnosed with it, I didn't even think it was possible. 5.5 months pregnant, I thought I was going to have my baby. I never even thought of anything like that even happening. So, thank you guys anyway for listening. Till next time.